In today's video, we cover 16 of the most common case manager interview questions that the hiring manager will ask during your interview. Each answer can be customized to highlight your unique qualifications and experiences. Before your interview, it's important to research the company and review the job description so you can incorporate key skills relevant to the job role in your answers. Question number 1. Tell me about your experience as a case manager. To answer this question successfully, describe your relevant experience, skills, and how you've helped others. If you have experience, provide specific examples of your work and the impact you made. If you don't have experience, highlight transferable skills, related education, or volunteer work that demonstrates your ability to handle the responsibilities of a case manager. Be concise, but show enthusiasm for the role. First, here's a great sample answer for someone with experience. I've worked as a case manager for the past 3 years, and during that time, I've helped clients navigate complex situations to get the support they need. For example, I assisted families facing housing insecurity by connecting them with temporary shelters and long-term affordable housing solutions. I also worked with individuals managing mental health challenges, helping them access counseling, medication support, and job training programs. Building trust with clients is one of the most rewarding parts of the role, so they feel supported and empowered to achieve their goals. In addition to working directly with clients, I've coordinated with community organizations and healthcare providers to ensure everyone involved is on the same page. This experience has taught me how to manage multiple cases effectively while giving each client the attention they deserve. Now, here's a great sample answer for someone without experience. Although I haven't worked as a case manager before, I have experience in roles that require similar skills. For instance, while volunteering at a community center, I helped individuals complete applications for housing assistance and connected them with local food banks. I also coordinated with staff to follow up on their progress, which taught me to track multiple cases and prioritize tasks. In my previous job as a customer service representative, I developed strong communication and problem-solving skills, especially when dealing with people in stressful situations. I've also taken courses in social work and psychology, which have given me a solid understanding of clients' challenges and how to approach them with empathy. I'm excited to bring my organizational skills and dedication to helping others to a role like this. Question number 2. What training or experience has prepared you to excel in this role? To answer this question, focus on specific training, certifications, or hands-on experiences directly related to the skills needed for the role. Use real-life examples to show how your background has prepared you for the responsibilities of a case manager. Emphasize qualities like organization, communication, and problem-solving that are crucial for the job. Before we continue, don't forget to customize the answer by adding your personal work experience and skills. My formal training and hands-on experience have prepared me well for this role. I earned my degree in social work, where I gained a strong foundation in understanding client needs, community resources, and effective case management practices. During my internship at a local nonprofit, I worked closely with clients facing housing instability. I assisted them in creating personalized action plans and connecting with local support services. That experience taught me how to balance compassion with practical problem solving. After that, I worked as a case coordinator for 2 years, managing a caseload of over 25 clients. I learned to stay organized, prioritize tasks, and keep detailed records, all while building strong relationships with the people I served. I've also attended workshops on crisis intervention and trauma-informed care, which have helped me handle challenging situations with empathy and professionalism. This has prepared me to step into this role and make a positive impact. Question number 3. What specific interests or specialties do you have in case management, if any? When answering this question, focus on being honest about your interests or specialties in case management while aligning them with the job role. Show enthusiasm for aspects of the work that match your skills and values. Be specific, but avoid overcomplicating your response. If you don't have a particular specialty, express a willingness to learn and grow in the field. I've always been passionate about helping individuals navigate complex systems and find solutions that improve their quality of life. One of my specific interests in case management is working with underserved populations, particularly in connecting them with healthcare and housing resources. I've found that advocating for people who may not know how to access support is rewarding and an area where I can make a meaningful impact. While I've worked primarily in healthcare-related case management, I'm also interested in exploring areas like mental health support or career development assistance. What I enjoy most about case management is its variety and the opportunity to develop relationships with clients while making a positive difference in their lives. I'm open to broadening my experience and am always ready to learn more about the specific needs of the populations I serve. Question number 4. Walk us through your typical day at work. When asked to describe your typical day, focus on outlining your main responsibilities and how you prioritize tasks. Emphasize time management, flexibility, and how you ensure clients' needs are met. Be clear and honest, showing an organized and proactive approach to your work. Tailor your response to reflect the specific duties of a case manager role. A typical day as a case manager starts with reviewing my schedule and prioritizing tasks. I check emails and voicemails for any urgent updates or client needs. Then, I review my caseload to ensure I'm on top of upcoming deadlines, like submitting reports or coordinating services. After that, I often meet with clients in person or virtually to assess their progress, address concerns, and connect them with resources they might need like housing assistance or counseling services. Throughout the day, I document interactions, update case files, and collaborate with other professionals, such as social workers or healthcare providers, to ensure we're aligned on care plans. Unexpected situations can arise, like a client in crisis or a change in a service provider's availability, so I stay flexible and adapt my schedule to handle those. Before wrapping up, I review what's planned for the next day and make notes to stay prepared. My focus is always on balancing the immediate needs of my clients while staying organized and meeting longer-term goals. Question number 5. What information do you need to have to create the patient's health care plan? To answer this question, focus on showing your understanding of what it takes to create a comprehensive and individualized care plan. Highlight key areas of information needed while demonstrating that you approach patient care thoughtfully and holistically. Keep the tone conversational and practical. To create a patient's health care plan, I need a complete picture of their medical history, current health conditions, and treatment goals. This starts with understanding their diagnosis, current medications, and any past treatments they've undergone. I'd also want to know about their lifestyle, such as their daily habits, living situation, and any support systems they have, because those factors can impact how they manage their care. It's important to consider any barriers they might face, like financial challenges or transportation issues, so that we can address them upfront. On top of that, I'd gather input from the patient themselves, their priorities, how involved they want to be in decision-making, and what kind of outcomes they hope to achieve. Collaborating with other providers like doctors, therapists, or social workers helps me ensure the plan covers all angles and is realistic to implement. The goal is to create something practical that fits their needs and supports their well-being. Question number 6. How do you manage transitions in a patient's healthcare plan? To answer this question well, explain your approach to ensuring a smooth transition for patients. Focus on communication, organization, and patient advocacy. Highlight how you work collaboratively with the healthcare team, patients, and families to minimize stress and ensure continuity of care. Use a real or hypothetical example to illustrate your process clearly. When managing transitions in a patient's healthcare plan, I focus on clear communication and detailed planning. I start by reviewing the patient's current status and understanding their needs and goals. Then, I collaborate with the entire care team to create a plan that ensures continuity of care. For example, suppose a patient is being discharged to a rehabilitation facility. In that case, I ensure all necessary documents, medications, and follow-up appointments are ready before discharge. I also schedule time to educate the patient and their family about what to expect, who to contact for questions, and any potential challenges they might face. I stay in touch during the transition to address concerns and make adjustments if needed. I aim to make the process seamless for the patient and their loved ones while aligning the care team. Question number 7. How much negotiation do you have to do on a day-to-day basis? This question is designed to gauge your communication skills, problem-solving ability, and experience handling situations where different parties may have conflicting needs or expectations. Describe how negotiation is part of your role, the situations you handle, and how you work toward solutions that benefit all parties. Use specific examples to show your experience without overcomplicating the response. In my experience as a case manager, negotiation is a regular part of my day. I often mediate between different parties, whether advocating for a client to access resources, coordinating with service providers, or finding a middle ground between a client's needs and what's feasible. For example, I once worked with a client who needed a specialized treatment program that was not fully covered by their insurance. I contacted the treatment provider, explained the client's situation, and negotiated a reduced rate while working with the insurance company to approve partial coverage. This work requires active listening, clear communication, and focusing on the best outcome for everyone involved. While not every day involves major negotiations, advocating effectively and finding solutions is key to progress in this role. Question number 8. How would you rate yourself on providing necessary information to a patient's entire care team? To answer this question successfully, focus on showcasing your ability to communicate clearly and effectively with a patient's care team. Emphasize your understanding of the importance of timely and accurate information sharing to ensure coordinated care. Use specific examples or strategies you've used to keep the care team informed, demonstrating your reliability and organization. Avoid exaggerating your skills, but present yourself confidently. I would rate myself highly in providing necessary information to a patient's care team because I prioritize keeping everyone on the same page. Communication is at the heart of effective care, so I document important updates thoroughly and share them promptly. For example, when I worked with a patient transitioning from hospital to home care, I coordinated with the doctors, social workers, and physical therapists to ensure they all had the latest treatment plan and progress notes. I also made myself available to answer questions and clarify details when needed. I know that missing or unclear information can create confusion, so I double-check my records and confirm everyone has access to what they need. This approach has helped me build trust with care teams and, most importantly, provide better outcomes for patients. Here's a quick reminder. In questions 9 and 10, don't forget to customize the answer by adding your personal work experience and skills. Question number 9. Describe a time you worked with members of a patient's care team to achieve a significantly successful outcome. To answer this question, focus on teamwork and communication. Share a specific example where you worked with a patient's care team, outlining your role and the steps everyone took to achieve the outcome. Highlight collaboration, problem solving, and the positive impact on the patient. Make it clear how your efforts directly contributed to the success of the situation. In one case, I worked with a patient recovering from a severe stroke who needed support transitioning back home. I collaborated with their physical therapist, occupational therapist, social worker, and primary care physician. I coordinated everyone's input and created a cohesive care plan. We scheduled regular team meetings to discuss progress, identified challenges the patient faced, and adjusted the plan as needed. For example, the therapist noticed the patient struggled with mobility at home, so I arranged for additional home modifications and ensured they had access to assistive equipment. The social worker and I also worked together to secure funding for transportation to follow-up appointments, which was a significant hurdle for the patient. This teamwork allowed the patient to recover faster, regain independence, and avoid hospital readmission. Seeing everyone's contributions come together for the patient's benefit was incredibly rewarding. Question number 10. Describe a time you communicated complex medical information to a patient in a way that was easy for them to understand. To answer this question effectively, focus on an example that shows your ability to simplify medical jargon or technical information for someone who may not have a medical background. Emphasize your empathy, patience, and communication skills, and explain the steps you took to ensure understanding. Use a clear and structured example, ending with the positive outcome of your approach. In my previous role, I worked with a patient who had just been diagnosed with diabetes. They were overwhelmed by the information provided by their doctor, especially about how to manage their insulin. I noticed they were confused by the medical terminology, so I took a moment to sit with them and break it down. I explained insulin as a helper that balances sugar in the blood. I compared checking their glucose levels to checking the fuel gauge on a car, simple, relatable concepts. I also used a visual aid, drawing a basic diagram to show how food, insulin, and blood sugar work together. To clarify it, I walked them through their daily schedule and helped them plan when to take their insulin, tying it to regular habits like meals. At the end of the conversation, I asked them to repeat their understanding to ensure everything was clear. They smiled and said, "I think I can do this now." It felt good to see their confidence grow. Now, before we continue, check out these awesome videos. I have posted the links to them in the description below. Also, don't forget to like and subscribe to my channel for more great videos posted every single week. Question number 11. How would you minimize your patient's time in the hospital? To answer this question well, focus on practical, patient-centered strategies that show you understand the importance of reducing hospital stays while maintaining quality care. Highlight your ability to collaborate with healthcare teams, streamline discharge planning, and connect patients with resources for recovery at home or in the community. Be specific about steps you would take and emphasize communication and problem-solving skills. Minimizing a patient's time in the hospital starts with a strong discharge plan as soon as they're admitted. I would work closely with the healthcare team to assess the patient's condition, understand their medical needs, and identify potential home recovery barriers. Clear communication is key, so I would involve the patient and their family in planning, ensuring they understand the next steps, and feel confident about their care after leaving the hospital. I'd also prioritize services like home health care, physical therapy, or follow-up appointments to ensure they have the right support after discharge. If social or financial challenges arise, I'd connect them to resources like transportation assistance or community programs to prevent unnecessary delays. My goal would be to create a seamless transition that prioritizes the patient's health and safety while reducing their hospital stay. Question number 12. Recall a time you had to manage conflicting priorities. What was your process for working things out? To answer this question well, describe a specific situation where you faced conflicting priorities. Explain how you assessed the situation, prioritized tasks, and communicated with others involved. Focus on showing your organizational skills, decision-making process, and ability to stay calm under pressure. End by highlighting the favorable outcome or what you learned. In my previous role, I managed a caseload of clients while helping coordinate an emergency housing placement for a family. At the same time, I had a scheduled meeting with a community partner. All three required immediate attention, and I had to figure out how to manage everything without dropping the ball. First, I took a moment to assess the urgency and impact of each task. I realized the emergency housing placement was the most time-sensitive and directly impacted someone's safety. I paused my other work to secure that placement by contacting the housing agency and completing all the paperwork. Once that was resolved, I informed the community partner that I might be late for our meeting and gave them a brief update on why. Then I adjusted my schedule to follow up with my clients later. This approach worked because I stayed calm, communicated clearly, and focused on what mattered most. It taught me the importance of flexibility and keeping people informed when priorities shift. Question number 13. How do you evaluate the care patients received while in the hospital? To answer this question, show your understanding of evaluating patient care based on clear criteria such as quality, patient satisfaction, and treatment outcomes. Share specific actions you would take, such as reviewing patient feedback, assessing progress toward treatment goals, and collaborating with healthcare staff. Highlight your observant, empathetic, and detail-oriented ability while focusing on continuous improvement. When evaluating the care patients received in the hospital, I look at several factors to ensure it was effective and met their needs. I start by reviewing their treatment plan and checking if the goals outlined were achieved during their stay. I also gather feedback directly from the patient and their family about their experience, focusing on how well they felt supported and if their concerns were addressed. I also collaborate with the healthcare team to identify gaps in care or areas where we could improve. For example, if a patient mentions delays in getting assistance, I would address that feedback with the team to find solutions. My goal is to balance the medical outcomes with the overall experience, ensuring patients leave the hospital feeling cared for and confident about the next steps in their recovery. Question number 14. How do you handle transitions in a patient's healthcare plan? When answering a question about handling transitions in a patient's healthcare plan, focus on showing your ability to coordinate effectively, communicate clearly, and ensure continuity of care. Share a specific example if possible, and emphasize your attention to detail, collaboration with other professionals, and commitment to the patient's well-being. Make sure your answer reflects empathy and problem-solving skills. Transitions in a patient's healthcare plan require clear communication and careful planning to meet their needs without interruptions. When I handle these transitions, I first ensure I fully understand the patient's current care plan, goals, and any concerns they or their family might have. I collaborate with healthcare providers, such as doctors, therapists, or social workers, to create a smooth path forward. For example, suppose a patient is moving from a hospital to home care. In that case, I work closely with the discharge team to coordinate services like home health visits, medication management, and follow-up appointments. I explain the changes to patients and their families so they feel confident and informed. I check in regularly after the transition to address any issues and adjust the plan if needed. My goal is to ensure the patient feels supported and that their care remains consistent and effective during the process. Question number 15. How do you stay current with best practices and changes in case management? To answer this question, emphasize your commitment to staying informed and continuously learning in your field. Share specific methods or resources you use, such as attending training sessions, joining professional organizations, or keeping up with industry publications. Show that you value best practices because they improve your ability to help clients effectively. Ensure your response reflects a proactive approach and personal engagement with professional growth. Staying current with best practices and changes in case management is really important to me because it directly impacts the support I can provide to my clients. I make it a point to attend workshops, webinars, and conferences whenever possible to learn about the latest approaches and strategies. I'm also a member of a professional organization, which gives me access to valuable resources, including research articles, training opportunities, and networking events with other case managers. On top of that, I regularly review updates to policies and regulations related to my work to ensure I'm always following the most up-to-date guidelines. I find it helpful to connect with my colleagues too, as we often share insights and tips from our own experiences. This combination of learning and collaboration helps me stay on top of changes and improve how I serve my clients. And finally, here's the last question. Question number 16. How do you handle conflicts of interest or ethical dilemmas in your work? When answering a question about handling conflicts of interest or ethical dilemmas, the key is to show that you prioritize professional integrity, clear communication, and adherence to organizational policies or ethical guidelines. Provide an accurate or realistic example to demonstrate your approach, emphasizing your ability to resolve the situation fairly and thoughtfully. In my work, I always make it a point to follow ethical guidelines and put my client's best interests at the center of my decisions. Suppose I encounter a potential conflict of interest or ethical dilemma. In that case, I start by carefully analyzing the situation to understand all the factors involved. For example, there was a time when a client requested help with a service that I knew was offered by a close personal contact of mine. To avoid any appearance of favoritism, I disclosed the connection to my supervisor. I offered the client a full list of service options to ensure they had a fair choice. I also documented everything for transparency. For me, the priority is always to be open, follow the policies, and communicate clearly with everyone involved. It's important to stay focused on doing what's right, even if it means taking a harder path to resolve the issue. If you want to learn more on how to land jobs and reach your career goals, don't forget to hit that subscribe and bell notification button to get new videos every single week. Also, don't forget to hit that like button because that motivates me to keep doing what I do. Stay safe, keep smiling, and good luck.